When people hear the phrase Tylenol and autism, it tends to spark a very visceral reaction. Some people immediately jump to conclusions, assuming there must be a strong scientific link and that one simple over-the-counter medication has changed the trajectory of entire generations. Others roll their eyes, assuming this is another conspiracy theory with little scientific basis, and they lump it together with the long list of pseudoscience that often circulates when it comes to autism. But like most things in life, the truth is far more nuanced than either of those extremes. To really understand this topic, we have to unpack not just the scientific studies themselves, but also the way human beings interpret data, the emotional landscape of parents who are desperate to understand why their child struggles, and the cognitive traps we fall into when we try to find simple answers for deeply complex conditions. I want to begin with something that's often overlooked. Autism is not a disease. It's a neurodevelopmental condition. That might sound like semantics, but it's actually fundamental to how we frame the conversation. A disease is something that is acquired, something that invades the body, something you catch. Autism is a difference in how the brain develops, how neurons connect, how networks organize themselves. And because it's a developmental condition, the idea of causation becomes extraordinarily complicated. We don't just look at a single moment like, you ate this, or you were exposed to that. Instead, we're looking at a cascading set of developmental processes over years, influenced by genetics, environment, parental health, prenatal factors, and even broader cultural changes. So when someone asks, does Tylenol cause autism? The very question itself is already oversimplifying what's going on. Now, here's what we actually know. There have been some studies suggesting a correlation between acetaminophen exposure Tylenol being the most common brand name and an increased risk of neurodevelopmental issues, including autism and ADHD. But before we jump to any conclusions, let's unpack what correlation actually means. If we look at a large population and we notice that children whose mothers took acetaminophen during pregnancy have a slightly higher rate of autism, that does not mean Tylenol caused autism. It means that those two things occur together more often than chance would predict. But correlation can emerge for a lot of different reasons. For example, maybe the underlying reason a mother took Tylenol, such as fever, pain, or infection, was actually the factor contributing to altered neurodevelopment. Or maybe the correlation is statistical noise that disappears when you run the analysis differently. But here's the part where it gets psychologically fascinating. Humans are not good at living with uncertainty. Parents of autistic children, in particular, are often carrying an immense weight of guilt. They ask themselves, what did I do wrong? Was it something I ate? Was it a vaccine? Was it Tylenol? That guilt creates a psychological need to identify a cause. Because if we can find the cause, we can control it. We can say, it was this. If I had avoided that, my child would be fine. That gives us the illusion of control, even when the actual reality is that autism is an incredibly multifactorial condition with no single identifiable cause. So, in a way, the conversation around Tylenol is not just about medicine. It's about human suffering. It's about guilt, shame, and the deep human desire to make sense of pain. When researchers look at acetaminophen, the biological plausibility is not entirely absent. Acetaminophen works in the brain by altering certain neurotransmitter systems, especially the endocannabinoid system, which plays a role in pain regulation, stress response, and neurodevelopment. In theory, disrupting these systems during critical windows of fetal brain development could have downstream effects. That's why scientists are taking the hypothesis seriously. But plausible does not equal proven. And this is where people on both extremes get tripped up. The skeptical camp says, there's no proof Tylenol causes autism, so let's dismiss this entirely. The alarmist camp says, there's correlation and biological plausibility. Therefore, Tylenol is the villain. Neither stance reflects the scientific process accurately. What the scientific process actually does is accumulate evidence gradually. We look at correlations, we test hypotheses, we replicate findings. We look at animal studies, we compare across cultures. And even then, we rarely end up with a single smoking gun. Autism is more likely to emerge from an interaction of dozens, maybe hundreds of small factors. Genes that influence synaptic pruning, prenatal stress hormones, inflammation during pregnancy, epigenetic changes, nutrition, and maybe, in some cases, exposure to medications like acetaminophen. But the contribution of any one factor is usually small compared to the total complexity. Now, let me pause here, because part of what I want to do in this conversation is not just explain the research, but also help you notice what your brain is doing as you listen to this. Some of you may be clinging to the possibility that Tylenol is the cause, because that gives you clarity. Others may be dismissing it outright because you're uncomfortable with uncertainty and you want to shut the door on the possibility. This meta-awareness, watching your mind in real time, is actually the skill that I think is most valuable. Because in life, it's not just about what's true, it's about how we relate to uncertainty. Parents who blame themselves for every little decision they made during pregnancy often fall into depression or anxiety. Parents who dismiss everything out of hand may close themselves off from useful insights. The real challenge is sitting with uncertainty and saying, I don't know, and that's okay. Now, I want to shift the frame slightly. Instead of asking, does Tylenol cause autism? Let's ask, why do we as a society keep getting caught up in single-factor explanations for complex conditions? Because it's not just Tylenol. Before this, it was vaccines. Before that, it was refrigerator mothers. Decades ago, people genuinely believed autism was caused by emotionally cold mothers who failed to bond with their children. That theory caused immense harm because it placed blame squarely on the parents. Then the pendulum swung to vaccines, which caused a whole new set of problems. Now the discussion is moving toward things like acetaminophen, environmental toxins, microplastics, and so on. What all of these share in common is that they take something incredibly complex and reduce it to a single factor that can be controlled, avoided, or blamed. And while it's good to investigate these factors scientifically, the psychological danger is that we become addicted to simple explanations. So, what do we do with this? For one, if you are a parent of a child with autism, the most important thing is not to drown in guilt. Even if one day, 50 years from now, we discover that acetaminophen contributes in some way to autism, the truth is that you made the best decisions you could with the knowledge you had at the time. Blame does not help your child. What helps your child is acceptance, advocacy, and creating an environment where they can thrive. Second, for those of us who are trying to understand the science, we need to develop a tolerance for nuance. Science rarely gives us yes or no answers. It gives us probabilities, risk factors, and evolving understandings. And third, we need to recognize that behind every scientific debate are real human beings who are suffering, searching, and sometimes clinging to explanations as a lifeline. And maybe the deeper lesson here is that our relationship with uncertainty, control, and blame is just as important as the research findings themselves. Because even if Tylenol were proven to play a role, the fundamental challenge would remain: how do we live in a world where so much is outside of our control? How do we as parents, as individuals, and as a society navigate the unknown without collapsing into guilt, paranoia, or apathy? When we start to peel back the layers of this conversation, one of the things that emerges is the way we, as human beings, handle the unknown. And this is actually at the core of why something like Tylenol and autism becomes such a flashpoint. Because on the surface, it's a question about a medication and a diagnosis, but underneath it, it's a question about how we tolerate ambiguity in our lives. Think about what it's like to be a new parent. You're handed this tiny human being who depends on you for everything. Every cry, every cough, every change in behavior feels loaded with meaning. You're sleep-deprived, anxious, and surrounded by 1,000 different opinions from doctors, relatives, the internet, strangers in the grocery store. And in the midst of that, you have to make choices. Your child has a fever. The doctor says Tylenol is safe. You give it to them. Fast forward 2 years, you notice developmental differences. You get an autism diagnosis, and suddenly your brain starts rewinding the tape. What did I do wrong? Was it the Tylenol? Did I cause this? This is where guilt and uncertainty collide. From a psychological perspective, guilt is one of the most corrosive emotions when it is misplaced. Healthy guilt is when we know we did something wrong and we use that to change our behavior. If I yell at my partner and feel guilty about it, that guilt is actually adaptive. It motivates me to apologize, to communicate better next time. But misplaced guilt, like believing you caused your child autism by following medical advice and giving them a safe medication, is destructive. It doesn't lead to change because there's nothing you can go back and alter. It just eats you alive from the inside. And the more uncertain the science is, the more fertile the ground becomes for guilt to take root, because the human mind starts filling in the blanks. Well, if they don't know, then maybe it was my fault. This is why I often say that part of the healing process just understanding the medical facts is learning how to sit with uncertainty without letting it devour you. Our minds want closure. They want neat boxes, clear villains, a cause and effect chain we can point to. But real life is messy. Real life is probabilistic. Real life is a million small nudges that accumulate into outcomes that can never be traced back to one single choice. Autism is a perfect example of this, because if you zoom out to the research, what you see is a mosaic. Genes that influence synaptic development, prenatal exposures that affect brain wiring, social factors that influence detection and diagnosis. And then, yes, maybe even some contribution from medications like acetaminophen. But no single tile of that mosaic tells the whole story. And yet, as human beings, we often want one tile to explain everything. This tendency is actually rooted in our evolutionary psychology. Our brains evolved to look for cause and effect in the environment. If you ate a berry and got sick, you learned to avoid that berry. If you touched fire and got burned, you learned not to touch it again. Our survival depended on simplifying the world into causal rules, but the modern world is not that simple. A neurodevelopmental condition like autism is not a poisonous berry, it is a complex interplay of hundreds of factors across time. So our survival mechanism of find the cause and avoid it doesn't to map well onto the reality of autism. But our brains don't know that, so they keep searching for the berry. They keep trying to locate that one decision, Tylenol, vaccines, whatever it may be, that explains everything. Now, let's bring in another dimension, the role of trust in authority. When the Tylenol autism conversation comes up, people often feel betrayed. They ask, why didn't my doctor tell me about this? Or, why is the government allowing this drug to be sold if there is even a chance it could cause harm? This is where history plays a huge role. Over the past several decades, trust in medical institutions has eroded significantly. Scandals like the opioid crisis, where pharmaceutical companies knowingly downplayed risks, have left deep scars. Public health missteps, inconsistent messaging during crises like COVID-19, and the perception that profit sometimes outweighs patient safety. All of this feeds into a culture of mistrust. So when a study suggests a possible link between Tylenol and autism, people don't just interpret it as a scientific question. They interpret it as confirmation of a narrative. They lied to us again. They didn't tell us the truth. We can't trust them. This mistrust adds rocket fuel to the spread of simplified explanations. Because now, if you're a parent who's already struggling with guilt and uncertainty, and you come across a post on social media saying, doctors don't want you to know, but Tylenol causes autism, that feels emotionally true, it gives you both an explanation and a villain. And our brains love villains. Villains simplify the story. Instead of randomness and complexity, there's a bad guy we can point to. It's easier to be angry at Tylenol than to sit with the vast, unknowable complexity of neurodevelopment. But here's the cost. When we oversimplify and latch onto a single factor, we often miss the broader opportunities to support children and families. Think about all the energy that gets poured into debates about causation. Was it Tylenol? Was it vaccines? Was it something else? Meanwhile, the day-to-day reality for parents of autistic children is that they need support with education, therapy, healthcare access, and acceptance. The more we get caught up in blame and guilt, the less energy we have to actually create environments where neurodivergent kids can thrive. This is where I think it is helpful to step back and ask a deeper question. Why do we even need to know the cause? On the surface, it seems obvious if we know the cause, we can prevent autism, but let's interrogate that for a moment. Is the goal of humanity really to prevent autism, or is the goal to help human beings live full and meaningful lives? Because if we frame autism purely as something to be eradicated, we risk missing the richness of neurodiversity. Many autistic individuals bring unique perspectives, talents, and ways of thinking that enrich our world. Some of the greatest innovators, artists, and thinkers throughout history displayed traits we would now recognize as autistic. If our goal is only prevention, we may inadvertently devalue those contributions. If our goal is support and inclusion, then the urgency of finding a singular cause diminishes. This doesn't mean research into causation is invaluable. It absolutely is. But we have to be mindful of how we, as a society, hold that research. Do we use it as a tool for understanding and support, or do we weaponize it as a way to assign blame and feed guilt? Now, let's zoom in on the neuroscience for a bit, because this is where things get both fascinating and tricky. Acetaminophen, unlike many other pain medications, doesn't work primarily by reducing inflammation. Instead, it influences brain chemistry in subtler ways. One hypothesis is that it affects the endocannabinoid system, a system involved not just in pain regulation, but in mood, social behavior, and stress responses. Animal studies have shown that disruptions to this system during critical periods of brain development can alter social behaviors. That's where the hypothesis about acetaminophen becomes biologically plausible. But remember, plausible does not equal proven. And here rests the kicker. Many of the same brain systems affected by acetaminophen are also affected by prenatal stress, maternal inflammation, and other environmental factors. So even if acetaminophen contributes, it's likely one of many overlapping influences rather than the sole culprit. What is even more interesting is that some researchers are now thinking less about single exposures and more about cumulative neurodevelopmental load. Imagine the developing brain as a fragile scaffolding project. Every genetic variant, every environmental stressor, every chemical exposure adds a little weight to that scaffolding. Most brains can handle a certain amount of load without collapsing. But for some, when the load crosses a certain threshold, development takes a different trajectory. In this model, Tylenol wouldn't cause autism in the traditional sense. It would just be one more weight on the scaffolding, pushing certain vulnerable brains closer to that tipping point. This perspective actually mirrors how we think about mental health more broadly. Depression, anxiety, PTSD, they're rarely caused by one thing. Instead, they emerge when biological vulnerabilities and life stressors interact over time. Autism may operate similarly. And if that's the case, then trying to reduce the entire condition to a single factor like Tylenol will always fall short. But again, this complexity doesn't sit well with the human psyche. We prefer binaries, safe or dangerous, cause or not cause, innocent or guilty. When science tells us, well, maybe under certain conditions, in certain populations, with certain vulnerabilities, Tylenol could contribute, that's deeply unsatisfying. It doesn't give us a clear action plan. And so people naturally migrate to the extremes, either rejecting the possibility entirely or treating it as gospel truth. I want to emphasize something here, because this is where the real work lies, not in whether Tylenol is guilty or innocent, but in how we respond to uncertainty as human beings. Do we spiral into guilt? Do we cling to villains? Do we shut down and ignore new evidence? Or do we cultivate the emotional resilience to live in the gray zone? Because if we can learn to live in that gray zone, then we can engage with science in a healthier way. We can say, yes, this is a hypothesis worth studying, but no, I will not let it consume me with guilt. We can say, yes, I want to know the risks, but I also recognize that every decision in life carries risk, and that's part of being human.